skips a beat. Ollie Murs, shitty bang. Man, them girls, man, they make your heart skip like.
Hypertension is the buildup of fatty deposits and plaque in the arteries, which occludes and restricts blood flow.
And most preventable causes of hypertension are smoking, obesity, and lifestyle habits such as sodium intake and inactive lifestyle. And these are the stages of hypertension.
On our floor, we saw that there was a knowledge deficit for patients with hypertension. This is why we decided to focus our project on active versus passive education. This issue is important because patients do not understand their disease or how severe it can be, which led us to our PICO question. In patients with hypertension, what is the effect of active education in comparison with passive education on patients' understanding of hypertension?
Active education is when a nurse talks one-on-one with a patient about their disease process. The nurse then explains any experiences the patient may have with having this disease and answers any concerns or questions the patient may have. Passive education is when a nurse briefly discusses with the patient about their disease process, but then hands a pamphlet to the patient so they can do the rest of the teaching on their own.
We used a variety of databases such as CINAHL, PubMed, and Google Scholar with various terms and with limitations of English language published after 2008 and full text availability.
The article I found effects of 2 educational interventions on the management of hypertensive patients in primary health care was a quantitative random control trial design, level 1A, high quality. The article was showing how in 9 primary healthcare clinics in Brazil, physicians and patients were split into 2 groups. One being passively educated on hypertension, and the other being actively educated on hypertension. The actively educated group of patients outperformed the passively educated group of patients by having more knowledge on what hypertension was, the risk factors it brought along, and ways to treat it, such as changing their lifestyle, diet, and getting a hypolipidemic and antihypertensive drugs.
The article I found was Effective Intervention Strategies to Improve Health Outcomes for Cardiovascular Disease Patients with Low Health Literacy Rates, a systematic review. This article is a systematic review of 9 studies, 7 being randomized control trials, 1 being a non-randomized control trial, and the last was a before and after study. The systematic review was rated level 1 with a quality rating of B, showing good research evidence. The study compared tailored counseling to self-monitoring approaches on patient education for patients with low health literacy rates. After reviewing each type, studies found that among the interventions used, the tailored counseling approach was the most effective, providing patients with increased self-confidence with hypertension management and medication adherence.
In the first article, the development and validation of hypertension, and evaluation of lifestyle and management knowledge scale. It was a quasi-experimental research and had high quality. They took 404 patients and tested their level of knowledge on hypertension. This article helped us to develop our PICO question because we found the need for education when it came to patients with hypertension.
The article is using health literacy level and learning style preferences to optimize the delivery of health information. This is a level 1 good quality randomized control trial research study. Patients 18 and up with 2 blood pressure readings of 140/90 or higher were recruited from the Vanderbilt University Medical Center to evaluate effectiveness of personalized education in comparison to standard discharge education. The intervention groups received education tailored to their health literacy level or health literacy level in combination with their preferred learning style. Patients took a pre- and post-test to determine the level of understanding of disease and information retention. Overall, patients in the intervention group receiving the personalized combination displayed greatest knowledge and retention.
The research article, Effects of an Interdisciplinary Education Program on Hypertension, a Pilot Study, is a quasi-experimental study that studies the outcomes of a structured education program on systolic blood pressure related to the effects of hypertension. This study found that improvement in systolic blood pressure was greater in the group that received the structured education than in the control group, and no significant improvements in systolic blood pressure were made in the control group.
This is significant to the PICO question because participation in an interdisciplinary educational program was associated with a reduction of systolic blood pressure. This research article is level 2 because it is quasi-experimental and uses meta-analysis from other systematic reviews and research studies. This study is of good quality and generalization of the results is limited because of the small sample size associated with the pilot study.
Recommendation is that our floor should require active education compared to current practice where nurses only do passive education because most of the patients on our floor are just being readmitted for the same issue that they have had before. Implementation of this recommendation will lead to positive outcomes by having lower readmission rates, increased medication adherence, and overall better education of hypertension and how to manage it.